Efforts to contain the deadly Ebola virus in West Africa have not done much to stop the fear of a widespread outbreak. Residents in the most affected countries worry about containment as they bury their dead. And there is growing concern among people in the U.S. as an aid worker infected with the disease arrives for treatment. Our Kwan So-wa has this report.
The death toll from the Ebola outbreak has reached an alarming 729, which according to the World Health Organization is likely to be even higher. The fear and panic among residents in the countries most affected is rising. People in a village in Liberia, one of the 3 African countries hit hardest by the outbreak, chased away health workers and soldiers who tried to bury victims in local areas. Although the victims are buried in plastic bags, residents fear catching the disease. Some yelled, "You'd have to kill us all first," to the soldiers. Concerns about the outbreak hit home in the U.S. on Saturday as an American aid worker who contracted Ebola arrived at an Atlanta hospital for treatment. Dr. Kent Brantley is the first of 2 American aid workers with the disease to be treated in the U.S. The medical personnel handling the case made sure he was traveling under the highest level of protection from the plane to his suit. But while some people say it's fair to allow a U.S. citizen to be treated in his own country, others fear a local outbreak. The other aid worker, Nancy Wrightball, is expected to be transported to the hospital within the next few days. In Korea, the health ministry has asked the Ministry of Foreign Affairs to delay the re-entry of Korean citizens traveling home from the affected areas in Africa if they have symptoms such as fever and nausea that could be related to the disease. The Foreign Affairs Ministry is also discussing whether to issue travel warnings for adjacent areas. Kwon So-wa, Arirang News.